name is Nightwind, and I am 72 years of age. I'm retired. I referee basketball and track, and I also do football. And in between that, I do a lot of working on our farm. We do a lot of landscaping. We do a lot of wood cutting because we burn wood. So we keep busy. My basketball refereeing had to be postponed this year because my knee was so bad. I just couldn't move fast enough and agile enough from side to side. And it's made it difficult for me to kneel down. I have to lift my left leg into the car. I cannot pick it up and do it myself. So it's just given out.
Knight comes to see me for his knee, and really he's an ideal candidate for a knee replacement. He's part of a growing trend of Americans who are trying to still be as active as they were when they were younger, but they're limited by their joint problems. He had gone through all the conservative steps prior to seeing me. He had injections. He tried to limit his activities. He was wearing a knee brace. He was taking oral anti-inflammatories. And when he came to see me, he was ready to talk about surgery.
The pain wasn't going away, and it just wasn't getting any better. It was getting worse. I'm ready now mentally to have my knee replaced. You've got an active lifestyle, and the knee is not allowing you to do what you want to do.
When I talk to patients about knee replacements, I like to talk to them about expectations. I always tell people the best knee you ever have is the one that you're born with. The problem with the knee replacement is it is artificial, but the goal of a knee replacement is to help relieve pain. Most patients are very happy they had a knee replacement because that pain is gone.
I decided to go with the custom knee because I read an article in the newspaper about Dr. Lindsey, and that he specialized in knee replacement that was customized to fit your knee.
The reason why I use ConforMIS knee replacements is the goal of any knee replacement is to try and restore the patient's anatomy back to what it was prior to them beginning arthritis. The problem with using an off-the-shelf knee is that they have to make adjustments into the patient's knee to fit to the options that they have available. And with ConforMIS, I'm reproducing their anatomy by using an implant that's made specifically for them.
You could have a knee custom fit to your bone structure, and that made a lot of sense to me. If I'm going to have it done, I want it done the right way. For my first visit with Dr. Lindsey, he had the total picture of what my knee looked like. We discussed the custom knee and basically how it works and what it looks like. I got photos of it. He sent me brochures that I could take home.
I spend a lot of time educating patients about the process of a knee replacement. We've created some literature for them to read and spend a lot of time reviewing models and examining their x-rays with the patient in the room.
Obviously, we had more questions, but then he offers a joint camp, a walkthrough, covering everything imaginable. Preparation, what you're going to experience the day of, what you're going to experience the day after, what you're going to experience the next 6 weeks. And so we have a very clear picture of what we're getting into.
When it comes time for surgery, I know that this is a big commitment for each patient. And I want them to know how much I care for them and how much I want them to have a good outcome. On the day of surgery, patients will typically be checked in 2 hours in advance. They'll have an IV started. They'll be given antibiotics prior to surgery. I'll see the patient and answer any last-minute questions, sign their surgical site and verify their consent, and then shortly after, the anesthesia provider will verify the anesthesia plan and get them ready for surgery.
I know I'm in good hands with Dr. Lindsey. He's young, he's had great experience, and I'm going to have one of the best surgeons that there is, and he's going to give me a great knee. There's lots of things in your mind that you're concerned with. How's this going to work? Am I still going to be able to have the same kind of movement that I had before? What kind of level of pain are you going to experience? They do a lot at the hospital to minimize pain.
At Southwest Health, we take pain very seriously. The patients typically receive a spinal anesthetic to block pain during surgery. I also inject medicines that numb the knee. After surgery, they receive a nerve block which numbs the front of the knee and helps decrease the amount of narcotics patients need. And lastly, patients will receive an ice machine to help decrease their swelling after surgery. Collectively, these together make patients have ultimately a better experience than I think most anticipate. After surgery, you'll be seen by one of our medical providers in addition to being seen by myself. Therapy typically begins the day of your surgery with the goal to try and get you on your feet as soon as possible. Therapy will see each patient twice a day until they are discharged home.
My expectation is I'm going to continue to be able to do what I was doing prior to knee surgery. And that is, I want to enjoy my property, I want to enjoy hunting, I want to continue to referee, I want to be active and mobile. I believe that at my age, you got to stay active to stay fit. It's going to lead to a longer life, and I know I'm in good hands with Dr. Lindsey and Southwest Health.